Good morning, ladies and gentlemen. Welcome to the IISS. I am Virginia Comolli, Senior Fellow for Security and Development. It's a great pleasure to welcome you all here today for a discussion on the challenges of the narcotics trade in Afghanistan and responses to such challenges. This event follows from a project that Security and Development Program ran last year on drugs and conflict prevention in Afghanistan. And if you're interested, there are more details available on our website, including a report that we have produced on the subject. The project, that was sponsored by the Open Society Foundations, acknowledged that with the withdrawal of NATO troops from Afghanistan, stabilization efforts were likely to be undermined by the growing drug trade and competition over its control. But we also recognize that in spite of all of this issue was too often relegated to the margins of policy debates. Therefore, we concluded that promoting engagement with Afghan officials and experts would be beneficial to reverse this trend and also to promote multidisciplinary approaches. And it is in this vein that today we are bringing the discussion to London, and I'm very honored to be hosting His Excellency Jawed Karim, Deputy Minister of Counter-Narcotics of Afghanistan, and His Excellency Dr. Ahmad Jan Naeem, Deputy Minister of Public Health of Afghanistan, who will shortly be sharing their experiences with us in dealing with this challenge and also their implications. His Excellency Mr. Karim is the Deputy Minister of Counter-Narcotics for Policy, Programs and Coordination, a position that he has held since early 2016. Previously, he has held a number of positions within the Ministry of Agriculture, Irrigation and Livestock. He has also taught at the University of Kabul and at other educational establishments, and also has some prior experience in the media. His Excellency Dr. Naeem is the Deputy Minister of Public Health with responsibility for policy and planning. He is also the Chair of CCM-Afghanistan and a member of Program and Policy Committee of the Board of GAVI. He is a medical doctor with expertise in health systems development in post-conflict settings. He has a nearly 30-year experience working for national and international public health institutions, including government bodies and national and international NGOs. Before I offer the floor to our speakers, let me remind you that the event is on the record, and at the end of the presentation there will be ample time for questions and answers. Let me also remind you that at the end of the event at 12, there will be a buffet, a sandwich lunch that you're very welcome to attend. And then at 12:30, there will be another event hosted this time by our South Asia program that will focus on U.S. policy in South Asia under the Trump administration, touching upon U.S. relations with Afghanistan, India, Pakistan, and Iran. But now, without further ado, I'd like to invite Mr. Karim, Deputy Minister of Counter-Narcotics, to take the floor.
Thank you, Kamala. Thank you very much. Good morning, ladies and gentlemen. It's an honor to be here, and I'd like to thank IISS for providing the opportunity to talk about counter-narcotics. It's not a secret anymore that drugs are everywhere, every society. It just depends on the intensity where we have it less or more. But unfortunately, the entire globe is now suffering from that. As we discussed, I'll not talk much about the addiction and all that, which my colleague Deputy Minister Ahmad Jan Naeem will take care of. I'll go into with more of the problems that we have with narcotics. I understand mostly us, Afghanistan, are mostly mentioned and blamed for the cause of narcotics and drugs. But let me say that we're sorry for that if we are causing any trouble anywhere. But the problem is, what the misunderstanding is, that it has been always thought that it's a linear problem. It starts somewhere, it ends somewhere else. However, our understanding is this is a vicious circle that continues to circle. It's not a line. This vicious circle is composed of different parts. It's namely the precursors that are used to change poppy into heroin, the cultivation of poppy, the changing poppy into heroin, and the process of the labs, the precursors, the trafficking of heroin through different routes, which in Afghanistan's case it's Balkans, Iran, Pakistan, Russia, and other neighboring countries, and then the use of that, mostly the Afghan narcotics into Europe and UK. The circle starts again and continues to rotate, so that's the circle and goes on and on. Unfortunately, Afghanistan is also part of that vicious circle, and that is the cultivation part. One cannot deny that. But unfortunately, in that vicious circle, there's that one part of that which is the cultivation. However, only cultivation cannot harm the society that much unless the circle is complete. Though with that said, we do apologize that even if we're part of that, one part of that circle, we're trying our best to stop that. In fact, the drugs with all that circle and we being part of that has given the most problem to us. We have a bad name, our society has been affected, our economy is affected, and we have an active insurgency fueled by that drugs and all that, and nowadays also millions as addicts. Ladies and gentlemen, Afghanistan is doing its best to tackle the national causes, to tackle the causes of the narcotics. I'll talk about those causes a little bit more in detail, but we believe it has the factors that are related to our local or national events, to regional areas, and to some international problems at international levels. To tackle the problem, we have a document, we call it the strategic document, which is the strategy for counter-narcotics, and then based on that strategy we have an action plan divided into 3 parts, which I'll talk about that. But before going there, let me just give you some figures. Last year, around 201,000 hectares of land was cultivated, and it was under poppy. And from that, around 4,800 tons of poppy were produced. The UNODC estimates are that annually the entire business or value of heroin across the globe would be around $55 billion. So a very tiny bit of that is under the borders of Afghanistan. The rest is completely out of that. Talking about the 3 areas, we are focused as in government, we're focused on 3 areas: decrease in cultivation of poppy, dismantle the trafficking of poppy, and third one, treatment of addicts. That's basically our strategy, and that's how we focus our activities. In the first one, in order to decrease the cultivation of poppy, Afghanistan has focused on 2 targets. First, to provide alternative livelihoods, and second, to eradicate poppy fields physically. On the first target, Afghanistan, with the help of its international partners, has provided hundreds of alternative livelihood projects to the farmers in the affected areas. Unfortunately, DFID, through a project called Comprehensive Agriculture and Rural Development Framework, has been a prominent player in that. Or that Cardiff, for the Comprehensive Agriculture Project, has provided 4,300 chicken farms, 820 greenhouses, and thousands of honeybees, including other projects in various provinces. And let me tell you, it has been very successful in some of the very remote areas where we really have the poppy problems, especially Helmand and Badakhshan. On the second target, Afghanistan has physically eradicated poppy fields every year, depending on security and availability of resources. As we are speaking now, in 4 provinces of the country, the physical eradication of poppy is in progress. I was getting the reports last night. Yesterday, we had a fight with the insurgents in one of our provinces in Nangarhar. The day before yesterday, one of our army guys was killed, 3 others were injured due to a fight. So that physical eradication is basically a combat. It's a direct fight on the ground with the insurgents. But with all that, Afghanistan and its government is serious, and we're doing its best to even eradicate it. On the second part, the Afghan government has focused on arresting traffickers and dismantling the big networks. The government has conducted almost 1,900 operations only last year. As a result of that, around 2,200 traffickers, which included some nationals from other nationalities also, were arrested. And around 605 tons of narcotics, different types of that, were confiscated. And around 108 labs were destroyed only last year. Let me also thank the UK government on this point, as it is helping a special unit of police that are working on this area, and they're very successful. And some of these guys who were arrested were on the international list as well. On the third area, which is related to the treatment of addicts and the problem with that, I'll leave that to my experienced colleague, Deputy Minister Ahmad Jan Naeem, to speak about. In addition to these areas, government is intensely working on the public awareness to have that across the globe, and especially in Afghanistan. Last year, because we have 26th of June as the International Day of Counter-Narcotics, but it was proposed to the Cabinet of Afghanistan that yes, we have a bigger problem. We cannot do it only in one day. It was approved in the cabinet that we will have a full week of counter-narcotics campaigning across Afghanistan, and every agency will take part in that. That's for the first time any country is doing that, and we have even now started talking to UN to see that if we can do it globally, to have one full week of counter-narcotics campaigning, at least to reach out to the masses. Now the question is, why, if we are all doing that much, we're not succeeding? There are numerous reasons, but the first and obvious one is that the problem is huge, and one government cannot tackle it, as it has national, regional, and international causes or factors. At the national level, Afghanistan is facing insurgency and insecurity, which are the causes and results of the narcotics being cultivated. We cannot deny that corruption is another reason that goes both ways. Moreover, poverty and lack of resources further fuel the narcotics cultivation. At the regional level, the trafficking of precursors, especially acetic anhydride, into Afghanistan and the trafficking of poppy and heroin out of Afghanistan is a major challenge. While Afghanistan cannot export its illicit agricultural products, heroin reaches every corner of the world. Lack of regional trust and information sharing is another big factor. And finally, the global demand for drugs is the international major cause of the problem. Does that mean we cannot do anything about it? No, we can. The real question is what to do and how to do it. But we propose we need to continue our fight, and we need to do it more. We need to tackle all those three areas at once. First and foremost, we should stop blaming each other, and we should fight together. As it is stated in the latest document of the UN General Assembly in November 2016, that narcotics and its fight is a mutual responsibility. We all have to accept the fact that we are all in it together. That would be our first win. Once we agree on that, we can work on the details of every factor that was mentioned before, and I'll just mention a little bit more about that. On locally or national levels, Afghanistan's government is committed nationally and politically to tackle the problem. However, it does not have enough resources to do so. The lack of resources should not be translated into the lack of wealth. Because in areas where there is active insurgency and the government is still going there, fighting actually, it seems a serious political well. But if the resources are not there, it's tough then to translate that into saying that, well, the government is not willing to do it. Financial and technical support should be widened to the institutions of Afghan government so they are well equipped to continue the fight at forefront. Afghanistan's farmers need help, and we need to provide that help, or else the traffickers are going to use the opportunity. Afghanistan's police need to be strengthened so they can do more. On regional level, another important action to be taken is to regionally work together. The first step is to stop the illegal import of acetic anhydride to Afghanistan. Afghanistan does not have any legal demand for acetic anhydride, which is the main chemical to change poppy into heroin. And let me tell you, around 7 to 10 liters of acetic anhydride is needed for 1 kilo of heroin. So in tons and tons that are imported. Afghan police are doing their best to stop this. The fact that Afghanistan is quite firm on that is clear from the prices if you see. Normally the prices of acetic anhydride per liter in the region would not go beyond $2 or something. But inside Afghanistan it reaches between $350 to $1,000 for a liter. It seems quite strict that the government is on that, and the tighter scrutiny that the police has. We need to stop that at source, and I discussed that last month in Thailand in a UN meeting as well. This is one of the big challenges, that if we can work on that together regionally. We need to be careful at the source when they're selling all that. In addition, the regional trust building is very important. Traffickers use the regional roads to do the smuggling. And if we, together as regional countries, share information and build trust, we can dismantle that. We can do even joint operations that we were successful to do it last year, at least with Tajikistan, across the borders, both sides. Internationally, it is also very important to address the problem internationally. On this level, we need to work on the demand side. In a free market, if there is a demand, definitely there will be supply. We need to decrease the demand to the extent we can. There is also a second area that we can focus a little bit more, is the amount of money that is involved is not entirely inside Afghanistan. It's a huge amount of money. Tracing that would help us a lot as well. as it was discussed with the head of the UN security when he was in Kabul and he met our national security advisor, one of the things he requested him was that please focus on that part. See, because it's a huge amount of money involved. We can trace that. It will help us trace it back there inside the country. Ladies and gentlemen, I'll stop here. I'll just share an incident. When I was entering UK, the immigration officer asked me that, what are you doing here? I said, well, I'm here for a conference on narcotics. And she was asking me that I'm still surprised at how that happens that they can smuggle drugs into this country but not other things. But that's $1 million question. We all need to work on that, and I'll leave that with food for thought. Thank you once again. It's an honor to be here, and thank you for being here. Thank you very much.
Thank you, sir. Thank you. Dr. Naeem?
Bismillahirrahmanirrahim. Madam Chair, Dr. Javed Qayyum, representatives from the diplomatic missions, ladies and gentlemen, good morning to all of you. I would like to start by appreciating. I would like to start by appreciating the organizers for hosting this meeting here in London at the International Institute of Strategic Studies. I'm grateful and honored to be given the opportunity to speak to you about the plight of the Afghan people, which is subject of today's discussion. Ladies and gentlemen, our efforts to achieve the vision of the health sector is in part hampered by the social ills, in particular drugs and substance abuse, and our communities. The Ministry of Public Health of the Islamic Republic of Afghanistan is the designated line ministry for drug demand reduction and has a mandate to coordinate and monitor the technical implementation of drug demand reduction activities. Other ministries and non-governmental organizations are also involved at various levels, as presented by my colleague, Deputy Minister Qayyum. Overall coordination is the responsibility of Ministry of Counter-Narcotics. Substance use has a detrimental impact on social cohesion, healthcare, the environment, national security, regional and international stability, international peace, and the sovereignty of countries. It undermines respect for human rights and the rule of law, socioeconomic and political stability, democratic institutions, and sustainable development. Globally, it's estimated that 1 in 20 adults, or a quarter of a billion people between the ages of 15 and 64, used at least one drug in 2014. Nevertheless, as over 29 million people who use drugs are estimated to suffer from drug use disorders, and of those 12 million are people who inject drugs, of whom 14% are living with HIV. The impact of drug use in terms of its consequences on health continues to be devastating, with an estimated 207,000 drug-related deaths in 2014, corresponding to 43.5 deaths per million people aged between 15 and 64. The number of drug-related deaths worldwide has also remained stable, though unacceptable. These deaths can be prevented. Studies have also found people who inject stimulants to engage in more risky sexual behavior, resulting in a higher risk of HIV infection than for those injecting opiates. Cannabis remains the most commonly used drug at the global level, with an estimated 183 million people having used the drug in 2014, while amphetamine remains the second most commonly used drug. In Afghanistan, a country that is in complex emergency for almost 4 decades, the situation is different. Loss of potential productivity due to disability and premature deaths are 2 serious consequences of use of opioids. Furthermore, the negative physical and emotional consequences of drug use are expected to have a significant and detrimental effect on the country's future development. The Afghanistan National Drug Use Survey 2015, that included toxicological testing, that's hair, urine, and saliva testing, was conducted by the United States Bureau of International Narcotics and Law Enforcement Affairs, with oversight by the Institutional Review Board of the Ministry of Public Health, and 24 of Afghanistan's 34 provinces. The result of the survey explored that the drug use is prevalent throughout Afghanistan, with highest rates of drug use taking place in rural villages. Key findings by the Afghanistan National Drug Use Survey reveals that almost 31% of all households tested positive for one or more drugs. Around 11% of the population tested positive for one or more drugs, with the rural population rate almost 3 times greater. That's 13% rural versus 5% urban. In general, the findings of above survey at national level has identified that 7.3% of Afghan population uses drugs, including 16% men and 9.5% women and 0.8% children. The result of Afghanistan National Drug Use Survey 2015 suggests that 2.3 million use opiates, or about 7% of the population. Approximately 0.9 to 1 million use cannabis, about half the rate of opioid users. The survey provides data on use, not addiction or abuse. Without access to advanced data examining social, environmental, and psychological factors, an estimate of Afghanistan's addiction rate remains impossible. In order to address the challenges of drug problem in Afghanistan, a series of key strategic actions were taken, one of which is the establishment of the Drug Demand Reduction Department in the Ministry of Public Health in 2006, with support from the Ministry of Counter-Narcotics and 12 out of 34 provinces. Later on, the program was expanded to the other 8 provinces in 2011. The program provides public awareness, counseling, treatment, rehabilitation, and social integration. The program by no means is sufficient due to the huge number of addicts and the scant resources to address the problem. In 2011, we were able to treat about 3,906 patients, provided 7,429 motivation sessions to undertake treatment, conduct and carry out a total number of 6,145 follow-up visits of the treated cases. Comparatively, the capacity of to address the drug problem increased gradually. In 2014, a total number of 41,677 patients were treated, and 76,221 individuals went through motivation for care session, and 80,730 follow-up visits were conducted by the program across the country. Meanwhile, there are around 103 drug addicts treatment centers in 32 provinces of the country, which provide outpatient, outreach, inpatient services, as well as therapeutic services at community level. Currently, Ministry of Public Health has the treatment capacity for a total number of 30,810 patients annually. A number of potential but common factors that result in drug addiction and abuse in Afghanistan comprise of insecurity, poverty, unemployment, immigration, wide availability of drugs, corruption, lack of law enforcement, and luxury. Among all the factors listed, the most potential factor is identified to be the insecurity. The existing challenge of insecurity has adversely affected the prevention and treatment programs. The best policy option for prevention of drug abuse in Afghanistan could be the improvement of inter-sector coordination mechanisms, mainly because drug abuse is not only a challenge limited to the responsibility of Ministry of Public Health. Rather, it is an issue related to several line ministries, including the Ministry of Counter-Narcotics, Ministry of Internal Affairs, Ministry of Defense, Ministry of Education, Ministry of Economy, Ministry of Religious Affairs, and Ministry of Labor. Due to lack of control of narcotic drugs, symptomatic therapy cannot be sufficiently capable to address the issue of drug abuse. It requires to be treated through replacement therapy with methadone and buprenorphine. Unfortunately, due to the high cost of therapy with methadone and legal barriers, this is still a failed option for addressing the drug abuse problem in Afghanistan. Distinguished representative, illicit use of psychoactive drugs is dangerous for the health of individuals and society. It induces changes in behavior and emotional status and could cause severe psychological disorders. It also undermines the social fabric of the community. The euphoric effects of drug leads to production of serious negative consequences on the brain, including seizures, stroke, and loss of interest in many areas of life. Other key adverse changes happening to the brain include memory problems, attention, and decision-making issues. In addition, long-lasting changes in the brain due to chronic use of some drugs such as cocaine, inhalant, ketamine, marijuana, and prescription of stimulants may result in paranoia, depression, aggression, and hallucination. As per the experience of a low-income and conflict-ridden country like Afghanistan, is that addicts to heroin ultimately leads to further impoverishment. Impoverishment plus addiction leads to mental disorders, seclusion due to the stigma attached with addiction, criminality, and antisocial attitude of the addicts. The adverse health effects of drug abuse have been reported on cardiovascular system, ranging from abnormal heart rate to heart attacks, collapsed veins, and bacterial infection of the blood vessels and heart valves are the attributed side effects caused by drug abuse. Similarly, smoking cigarette has shown to be the cause for the development of bronchitis, emphysema, and pulmonary cancer. Research studies have, on the other hand, shown that chronic use of some drugs, including heroin, inhalants, and steroids, would result in potential hepatic damages. Dependence on drug has enormous cost for society in terms of direct and indirect health and social consequences. Human and financial resources lost due to abuse, and the workplace, road, and domestic accidents related to drug abuse. Healthcare costs related to diseases that develop in relation to drug dependence, HIV, hepatitis, and other diseases including mental disorders, and social problems including drug-related crimes and deaths due to overdose. The majority of these costs are difficult to quantify, but the few available studies indicate that a direct correlation exists between addiction and the problems stated above. Esteemed colleagues, ladies and gentlemen, there are some key recommendations which need to be considered at policy level to address drug-related issues, some of which include the need for better coordination between counter-narcotic focused agencies, mainstreaming counter-narcotics efforts and all development planning, and need for sustained support to enforcement agencies to carry out eradication, interdiction, and arrest of those involved in the illicit drug trade, increased provision of treatment facilities for drug dependents, especially in rural areas, the development of an Afghan-led national drug prevalence survey, and the need for strong political will, sufficient resources and coordination for the development, rollout, and monitoring and evaluation of comprehensive alternative development intervention across the country. According to the Integrated Biological and Behavioral Surveillance 2009-2012 assessment in Afghanistan, people who inject drugs remain the population with the highest prevalence of HIV and HCV, that's hepatitis C virus, infection among all of the at-risk populations. People who inject drugs living in Herat province bordering Iran continues to have the highest disease prevalence. The HIV and HCV prevalence in Herat are found to be significantly higher than any of the other cities of Afghanistan. Illiteracy is high, which is 52.2%, and HIV knowledge is low, that's at 40% or lower across all cities of Afghanistan. 38.4% of the drug users are reported to buy sex from a female at least once in their life, Use of risk reduction services are low, which is 58%, and people who ever have received HIV testing are reported to be 29% only. People who inject drugs remain to be the principal driver of HIV infection in Afghanistan. Research has shown potential transmission of HIV from people who inject drugs to other at-risk population. That's female sex workers, men who have sex with men, prisoners, and road transport workers. Based on the results of integrated biological and behavioral survey, the HIV knowledge is low across all the population. That is 20% of female sex workers, 5% of men who have sex with men, 11% of prisoners, and less than 2% of transport workers have heard about HIV. Risky behaviors are significant across all population that were included in integrated biological and behavioral survey. Condom use is, and illicit sex is low. It means 64% of female sex workers in Kabul province and 67% of female sex workers in Herat province and 26% of female sex workers in Balkh province have used condom in their last sex. On the other hand, syphilis is highest among men having sex with men, which is 10%. Drug addiction is a growing problem globally and specifically in Afghanistan due to conflict, poverty, low literacy rate, unemployment, easy availability of drugs. This would require very close cooperation of different sectors, countries in the region, and the countries where there is demand for drugs. We need to focus on both supply and demand cycle. Afghanistan is a major producer of opiates, which fuels the conflict and criminality. On the other side, there is huge demand in Western countries. So far, Afghan government, with support from the international community, has been working on the supply side. We need to focus on the demand side as well. I quote Professor Dr. Wanda Philbert-Brown in her blog post on March 1st, 2017. She has recommended that even effective interdiction merely changes the smuggling route. This is in relation to Trump's administration, the wall that they are building between the United States and Mexico. She has written, even effective interdiction merely changes the smuggling route and methods. Unless demand is suppressed, demand must be reduced, which requires treating addicts. Harm reduction approaches save lives. Imprisoning users ruins them. Support to harm reduction and treatment of addicts in Afghanistan is decreasing, while drug abuse is increasing. If not supported, it would be a threat not only to the people of Afghanistan, but to the countries in the region and globally. Thank you very much for your attention.
Thank you, sir. I think we often think of Afghanistan as a country where drugs are produced, and we tend to overlook the problem of domestic use. We now have about 50 minutes for questions and answers. Please wait for me to call on you. And before you ask your question or you make your comments, please introduce yourself, especially for our speakers. We already have one comment here.
Thank you, Chair. I'm Mahmoud Ali. I'm a member of this institute. Thank you for sharing your insights, ministers. The question is this. Was there any measurable difference in both drug production, use, and transshipment following the withdrawal of the bulk of NATO ISAF forces from Afghanistan? Was it increased? Was it decreased? Was there no change? And how do you explain that? And a corollary to that question is, since many countries around the world which have not engaged in warfare and conflict for 37 years have failed to eradicate drug abuse, in the case of Afghanistan, do you think it would be realistic to visualize that you will eradicate drug abuse unless you reach a political resolution of your current conflicts? Thank you.
Do you want each question, or should we take some
We can
more?
take a couple. Danny, please.
I'm Danny Kushlik from Transform Drug Policy Foundation. We're a campaign to end the drug war. Firstly, I just want to say, whilst I appreciate your apology, it's us who should be apologising to you. And I think that's for two reasons. One is because we demand a lot of heroin in the UK and in Europe and in the global north. And also because we support a global drug control regime that actually creates a lot of the problems that Afghanistan faces. And that is the UN drug control system. I do have a question, but I just want to make one quick point about in 2008, the UN Office on Drugs and Crime recognized that its own drug control system, the prohibition-based system, creates 5 major unintended consequences. It creates the criminal market. It creates policy displacement from health to enforcement. It creates drug displacement. So if you win a battle against one drug, another one comes to take its place. It creates the balloon effect, and it creates human rights abuses for drug users. That's the UN Office on Drugs and Crime recognizing that its own system creates that. Now, that is the reason why Afghanistan is in the position that it is as the world's major producer of illicit opium, is because the UN's drug control system will force a country or a region into that position. And because Afghanistan has many years of fragility and insecurity, that's where opium has migrated to. And even if Afghanistan were able to rid itself of opium production, it would just move somewhere else. We know that. And that's what Van der Veldt-Brown was saying in her piece. And it's true. So the question for me is given that the world is now moving away from prohibition, both in terms of statewide legalization of cannabis in the US, Uruguay hopefully soon will legalize cannabis, and Canada will legalize cannabis next year. There is a move away. And I guess the question is, how much time do we expend, how much resource do we expend using a model that the UN Office on Drugs and Crime says creates these major catastrophic unintended consequences all over the world, including for Afghanistan? And how much do we begin to move away from that, including Afghanistan, to explore alternative policies where drugs are held within a legal regulation framework, and begin working from that position rather than a continuing futile battle to win a war that can't be won?
Okay. Thank you, Danny. I'll take one more question. Antoine.
Antoine Levesque from the IISS. My question is for both of you. You both mentioned that neighbouring countries could be helpful in tackling the issue. I'd like to ask you if any country in particular springs to mind in terms of it being particularly helpful. Could be a proximate neighbour or immediate neighbour. So I'm thinking, for example, of India, I'm thinking of Pakistan, I'm thinking of China. Is there counter-narcotics priorities set within the broader cooperation framework with any of those countries? Thank you.
You think they have been helpful in the past, or we think that they should be helpful?
Both.
Okay. Well, thank you. We have a good first set of questions on the impact of the NATO withdrawal and also the issue of political resolution. We also heard about issues with the drug control system, the unintended consequences of that, and also the question on the relationship with the neighbors, exactly whether counter-narcotics features in the discussions with your neighbors. Would you like to?
Thank you very much. I'll start with the first question, with Mahmoud Ali's question. I think I didn't say in my remarks that most of these cultivations happen in the areas that are either completely insecure or less secure. So the withdrawal of the troops definitely had impact on that area, that they were going out and our troops had to go, so it was stretching a bit thin. Some areas became more unstable, if I can call them, or unsecure. So in that nature, yes, it had negative impact on the cultivation and production as well, because those areas are more insecure, so you need more resources to fight there, and that results in more production or cultivation of poppy. In 2014, we had less cultivation, well, higher cultivation, 15, it decreased. I don't know the real reasons, but in 15 compared to 2014, we had less cultivation and less production. 2016, again, we had a hike in production and in cultivation. 2017, the year that is going now, we are afraid we will have again higher amounts of production. Causes go again back and forth. It could be the security again, it could be the global market, but definitely the remote areas where normally the cultivation happens in the south of the country, and south of the country is relatively insecure compared to last year. That could be one big reason for that, that this year we have more production. Though, compared to last year, government is firmer, politically more committed. We even started a war, when you can call it, where we're going to the field and every day it's a fight with insurgents. So in that sense, yes, it had its impact on that. And then if you go with the trickling down effect with the withdrawal, definitely we had less amount of aid, less working opportunities for people in the rural areas. You had the PRTs and all that. So that, if poverty being linked to cultivation of poppy, that had that trickling effect as well there. So in that sense, we think it did. The shifting policies, at the time, well, we're part of that convention, the famous UN convention. So we can't go beyond that. Legalization is often just discussed in these type of settings where we talk more academically as part of political agendas. It's still we're firm that the conventions that we have signed with UN, we'll stick to that and we'll do our best to do it. I think part of the question also that do we think we can do that, we can win it or not? It's a tough question. We all know that it's not an easy fight. There was, I remember only one time that I mentioned something of legalization, and quite a lot happened there. Oh, you're legalizing that, and it was when the police confiscate all these materials. Our law says, and because of this all convention that we have to burn all that. So at a point we suggested that, okay, if we're not legalizing the entire thing, what about this specific part that the police has captured it? So if we can talk to someone about this, and instead of burning all that, either we sell it to some pharmaceuticals or to someone who needs it, and then use that money for counter-narcotics purposes. It was a tough battle to win. We said, okay, we're not talking about that. Let's just fight it. As an overall, whether UN know that, I think they do. UNODC is a very close partner, has been a close partner. We'll be more than helpful, more than happy to work with them and see what are the alternative options. And we are also working on our policies inside the country on different fronts, on the cultivation, on fighting the cultivation, on trafficking and all that. So you'll see if there at any point of time we can think of a shift in our policies, and if we can find some reliable data to based on that, we're more than happy to do that. But as of now, no, it's just a matter of whatever the conventions are and the conventions that we have signed, and we'll go ahead with that. With the matter of neighbors, we have 3 routes, big routes that I can call them. Now the 4th one started last year. The first major one is through Balkans, Iran. That is, according to our estimates and according to UN's estimates, the major part of the trafficking happens through that, because it has a corner of where the land is there also and the water, so that's the major part. Then it's Pakistan, and on the other side we have Tajikistan, Uzbekistan, and then Russia through that. The newly route that we have some figures on are now one of our provinces in the west, which is Badghis, that it has a small border with Turkmenistan. Since 2 years, we have seen increase in production and cultivation and Badghis in some of our areas, and we believe that's mostly because of that new route. So based on that, we think these countries have the most importance in terms of working together. So Iran, the first one, Pakistan, and then this side, Tajikistan, Uzbekistan. With Iran, we have quite good contacts. There were some joint operations as well. With Tajikistan, there were some joint operations as well. Not at a level that we expect to even have shared information. There was also a cell established in Iran to share this information on cross borders and intelligence and all that, but not fully utilized yet. With Pakistan, unfortunately, we still have that problem. We couldn't build the trust that we really wanted to, or at least the impressions and all that. And farther than that, then going to Russia, we are in negotiations, but in an overall, as a region, I don't think we have that strong trust that we all these countries needed. And we cannot deny it now because the facts are there. If all these, we don't use all that what is produced there, what is cultivated, it goes out. So it goes out through somewhere. And that is our failure altogether. That's why I think we have to do it more. The two other countries that are somehow helpful, China a bit more, and they want to do it. We are in negotiations with them. They are now training some of our police and all that, and they have come forward to do some more help. They are also affected only from small part of Badakhshan, not a lot, but a little bit of that side. India only being a destination for some of the air smuggling, because we don't have anything on with them on water and all that except the Indian Ocean, but it's mostly the air and everything. We are in talk with them. Haven't seen, well, India is a great player there. I mean, they're helping a lot, but specifically with us in Counter-Narcotics, not yet, though we are in talks with them to see what we can do, especially in terms of treatment of our addicts and all that. India has a good system to do it. I won't talk about what we can do. I think the Deputy Minister will take on that part where the question was about the usage, but I think we have a lot of that problems. And let me add to that, somebody was saying, you were saying that we are blamed only for exporting. It's not that. We are also now, there's a problem with these new synthetic drugs that we don't have, and most of that is also now imported, the amphetamines and all that. So a big portion of our society, unfortunately mostly youth, are affected. The treatment, I don't know if we can win it with the current active insurgency, but what option we have, we just have to do it. But I'll not elaborate more on that.
Thank you. Thank you very much. I think most of the questions were responded by Dr. Kaim. I will comment only on the addiction in Herat, which is bordering Iran. Some of the Afghans, they go out of the country for economic reasons, and they go as workers to Iran, and some of them probably, since that's one of the routes, where the narcotics are going to other countries through Iran, so therefore the use of opiates is common in Iran as well. So when they come back, initially when they take opium, that increases their working power, and once they take it for a longer time, then they are weakened, and they become people who are not productive anymore, and then they come back to Afghanistan, and that's why the hepatitis and the HIV prevalence in Herat provinces among drug users, especially those who inject drugs, that problem is there. And similarly, in Pakistan is also in the past there were a number of drug addicts there, and some of them they returned back to Afghanistan. So that there is movement between Pakistan and Afghanistan and Iran, and they come and go. So therefore, the number of addicts that are in these provinces is higher than other provinces of the country.
And can you say a little bit about the cooperation with India that we just heard about?
With cooperation with India, currently they are not supporting drug demand reduction activities, but we have been discussing this, with them. Unfortunately, now, as I mentioned, in speech, that I initially gave, and the funding for drug demand reduction is reducing. For 2017, we had proposed a budget of $14 million to tackle the problem of addiction and drug demand reduction. With the Ministry of Finance, they allocated only $9 million. Similarly, INL is supporting the drug demand reduction interventions, and they are also gradually cutting down, on the support that they used to provide. And unfortunately, most of the interventions they are funded from external resources, because the government of Afghanistan is not able, to fund all the health intervention, from its budget. So that's also the donor dependency is another problem that we need to work on.
Okay, thank you. Yes, sir.
Yes, Kazan, I am a member of the institute. In Iran, there is a harsh punishment for narcotic trade and use, and every year hundreds of people are put to death because of that. I wanted to ask you if in Afghanistan you have also such punishment, and what's your view about this?
Okay, thank you. And the lady over there. Yes.
Hi, I'm Sophie Chowdhury, a journalist. I want to ask you about the new strain of genetically modified seed that comes from China, which allows opium cultivation on a year-round basis. What challenges have you come across with this new opium seed, and is it on the market?
Okay, thank you. Oh, yes, okay. Diva.
Number 60. Afghanistan is the war for decades now. So the question goes to Dr. Karim. The US has spent $8.5 billion since 2002 on counter-narcotics, but the cultivation doubled. The Taliban are making 17,000 million per year. The main cause is security, as you mentioned. Do you think that the neighbors could be one of the main causes to decline Afghan government counter-narcotic program, as terrorism gets advantage of it as well as the neighbors?
Okay, thank you.
Do you think that because of the security that the neighbors are actually causing, which is declining, so that the Afghan government is not able to function properly, to try to decrease the cultivation problem that you were mentioning? Do you think the security is the main problem because of the neighbors?
Okay, thank you. Okay, I'll take these three. So we have the capital punishment, the genetically modified seeds, and the security situation.
Thank you. So punishment, we also have in the law. There is also a new law in the parliament, which we're hopeful would be approved soon. But in our current law, which is in place, it's not as harsh as in Iran, but it has been divided into different categories. If you have someone with 1 gram, there's a punishment for that. But if somebody catches them with 2 grams, then there's a punishment. So there's a layer of that. There's been divided. And once it goes in kilos, then definitely it's a long-term imprisonment. We have also have now the specific police and specific system. So they don't go through the normal judicial system that takes years and years. There's a specific system for that. So the cases of narcotics are going through faster, and they get the punishment faster, and then they are in jail. And that, I believe, that is one of our very effective systems in this entire thing. When also there's talk about corruption and all that, but that system is functioning really well, because a lot of these big guys have been arrested, and then in a matter of shorter span of time, been convicted as well and gone through the judicial system, and then they are now in prison for 15 years, 20 years, and all that. So yes, that thing is there. On the China's new seed, unfortunately, we have seen that in the market. Yes, I recently had a trip to south of the country to Kandahar, and I've seen that this new seed is there. We don't know yet the entire qualities or criteria about that seed. What we know is that it's a new seed. It is more resistant, and farmers are not able to get seeds from it back. So it is just cultivated once, and then you get the product from it. Normally, the way they were doing, they were getting seeds back from their own fields as well. With this new Chinese seed, it's just that one time, and then you have to buy the seeds again. And we've also heard that this could be shown in a lot of other areas where it was not typically not proper for, because at the end of the day, poppy is also an agricultural commodity and it doesn't grow everywhere. But with this new Chinese seed, it's more resistant, it could grow in many other areas. That's the initial information we have, and that's why we believe that this year, because though it's initial years, last year it started, it would boost a little bit, unfortunately, of this entire product and all that. So that's the information at this point, but we're working on that more. Security, I mean, who's causing that? That would be very difficult to say, whether neighbors and all that, but yes, definitely security and narcotics go hand in hand. As I said, it is cultivated in the areas that are insecure, and Taliban specifically, they have specific taxes, an amount of tax that they call it OSHA, or 10% of the benefit that they get from it. And then in response to that, or in just to leverage that, they provide security for that, or safety for that, or they fight for those things. Yes, security in insecure areas, and any measure that deteriorates the security of the country adds to the problem of narcotics. And on the other hand, narcotics add to that. So these two things go hand in hand, and yes, it has its impact on the ground, and we can clearly see that. If it was not that, how normal people would be that even brave, if I can call it, where we go for eradication of the fields, we have army with us, and still they're fighting. So it's not a common, it's not like a normal type of thing. It's a major operation, and a lot of things are behind it.
Okay. So the gentleman in the second row.
Yes, thank you. I'm Mark Farrington, also a member of the Institute. I would just like to ask another question about the distribution routes that you mentioned. I mean, obviously those 4 routes are all neighboring nations and therefore would be considered intermediators rather than gateways into the place of demand in North America and Europe. What is known about the final leg of those distribution routes? Is it considered to be sophisticated organized crime, or is it more grassroots and ad hoc type of distribution that allows the opium to arrive in Western Europe and North America?
Yes, the gentleman over there, and then Monty. Please.
Richard Britton from ALSIS. Deputy Minister Naeem, you in your talk talked about the central importance of monitoring and evaluation. Coming back to Deputy Minister Naeem, you talk about your strategy and the implementation of that strategy. I'd be keen to understand more about what you're doing to understand the impact of your intervention. So, for instance, you mentioned CARDEF. One of the reasons CARDEF is successful is that it has 6 layers of monitoring and evaluation. Your eradication program has barely 2. I'm keen to know whether, after 15 years of repeated delivery, what you've learned from the implementation of eradication, because in theory it should be delivered where livelihoods exist, but yet where it is delivered are locations where livelihoods do not exist. So I'd be very keen to hear what you're learning through these annual interventions to see how you can improve year on year.
Thank you. Monty.
Monty Easton-Brown, research analyst at the Institute here. I also served in Helmand in the south with the British Army of your country. Deputy Minister for Counter-Narcotics Policy, a question related to the one we just had. One of the, you mentioned several times the combination of alternative livelihoods and eradication. And there was always, it seems when we were there, often a big conflict between the eradication itself and, of course, unintended consequences, especially when it occurs in an area where there were not any other livelihoods available. And you mentioned several times the conflict that happens. It's a battle every day. How do you balance those unintended consequences and to try and prevent the benefits of that can be got from that being outweighed by, for example, the negative impact of increasing conflict or insurgency, or in fact losing perhaps the hearts and minds of the people in those areas?
Thank you. So we have a question on the distribution routes into Western Europe and the US. What was learned from the various interventions that were done, and also this tension between the balance between eradication and unintended consequences?
Thank you. The distribution routes, I think it's mostly Europe. North America and America, Afghan doesn't go a lot there. It's a small portion of that. Well, we jointly work a lot with UNODC on these figures, and the figures are that it is either Taliban or part of that. It's not like an ad hoc thing. It's a proper system of smuggling and all that they do. Recently, it has also started going to Africa. So they use that route, Balkans, the Balkans route there to India, to Turkey, and then from there it also goes to Europe, and then a route to India, and from there to Africa. On the ground, I don't think we have much information on that, but I believe it's also the same that big network that goes back and forth, because what we think it's a network of that, because Afghanistan does not have a lot of history of narcotics being cultivated historically. What is now is mostly the poverty and all that, and these people come and give the farmers the benefits that they want, which most of the time government and donors cannot provide. So because the system goes quite efficiently, we believe it's not ad hoc, it's a proper system. On the implementation of eradication, I agree. We are in talk with our international colleagues and with our government, heads of the government, that all these efforts have to happen at least at the same time, at the same geographical location. Not only the alternative livelihood and eradication, it's also the public awareness part. Unfortunately, these mistakes have happened in the past, that awareness happened somewhere, alternative livelihood has gone somewhere, and we have done eradication somewhere. And it goes to your question as well, that it had its negative impact, because you're not giving them anything. I've been to certain areas for the eradication, and you clearly see, it seems quite easy from here when you say eradication, but when you are in the field, you see a poor farmer with his wife, 2 children, and they just lay down in front of your tractor and say, okay, you just bring your tractor on us because we have that small piece of land, and this is the only thing we can sell, and then you destroy your field. And you can clearly see that they're not smugglers. It's just a poor farmer that this is the only option they've got, and you don't have an option to tell together to them and say, look, I'm destroying this, but I'm giving you this. We are seriously working on that, and we see that as a major shift that should happen. All that should have come together. If we're going to an area, we have to go first with awareness, and that awareness should not be only on TVs, but with local people and all that. Then we should have something in hand to give it to them and say, look, this is alternative projects, and that should be the full cycle, not only giving them seeds. That had happened mostly. A friend who said, Monty, who said he was in Helmand as well, where at the times Helmand Food Zone was to just give them wheat seeds and all that. But to have a full value chain of agricultural crops, to give them this is what you should do, what you should cultivate, and then buying it back from you, because that's the important part, not that you're giving it to them. And then we'll go with the eradication force as well. We have completely realized it. That should be the way that it should happen. Did it happen fully like that? No, unfortunately last year, because we still couldn't get everyone on board. But we're trying at least to do it next year to get the international community, our own government and all that on board to agree to the terms of okay, we have to bring all this together there to that. The balance, I think this is how we would like to balance it. Actually, there is a checklist, or let me put it this way, there used to be a checklist of where to do the eradication. It was normally all these things had to be taken into consideration, that the farmer did not have only, that was not the only field he had, it was close to the road, at least it had water and had the option to grow and all that. There was a proper mechanism or checklist prepared for that. But unfortunately, due to security situations, I think most of the times we didn't really took into consideration the checklist. We just had to eradicate at the points where we could eradicate. I'm sorry I did not bring some of the maps that I could have shown, that in the areas where we did proper eradication with alternative livelihood projects, you could clearly see the results of that in those areas. Even in Helmand, you could clearly see during the years that we worked on, from 2013, you can see that it's been decreasing. In the areas where we have done only alternative livelihood projects or only eradication, and then the quality of eradication, the way we did it, you can clearly see that it did not have any impact on that. So the data is available there, and we're trying now to balance that, and based on that evidence-based type of policy develop and say, okay, this would be the proper way to go forward and eradicate it. Just to add to that, now saying that why, if in some areas were effective, why the amount is not decreasing is because the cultivation has gone to other areas. Cultivation does not happen anymore in the cities or close in the centers. It has gone to outskirts, mostly in Helmand. It has gone to a lot of these desert areas where now the new technologies are available and they can do a deep well anywhere in the desert. That's the only thing you need, water, and then the land is available. So because of that, because it has gone out of the cities, it's still the amount is there, but to look into that data, you can clearly see if all that happened together, we have less pop. In most of the areas, we have zero cultivation of pop.
Sure. I actually do have a question for you with regard to preventative measure. I'm thinking of the youth, young people. What initiatives are you doing to prevent young people from taking up drugs, or what initiative you would like to do with more funding, if more funding were available?
Okay, thank you very much. And in order to prevent, the youth to become addicts, the Ministry of Public Health we are working, on awareness about, the drug use and its abuse among the youth, and we are also working, with Ministry of Information and Culture. There is a Deputy Minister for Youth, and we are working with them as well. And similarly, we work, with the Ministry of Religious Affairs, where because all the drugs, basically, from the religious point of view, it's not allowed to take intoxicants. So for that reason, we will be working with them. At the same time, I think the number of people that has been tested, positive, for one or more drugs in the survey that was conducted in 2015. The number is huge, it's over 3 million. So and if we compare that, to 2010, 2011, it was about 1 million people who tested positive. But now we need to work, with communities as well, and probably we need to mainstream, some of the prevention activities into community-based healthcare, that is being provided through the implementation of the basic package of health services that Afghanistan has defined. So that would be the way forward, but that would require resources, of course, and the resources, unfortunately, they aren't there. So as I explained earlier, that the budget that we had requested for our current activities, and we do not have that, or maybe in the mid-year review we will try once again, we can secure, the funding that's necessary for current activities. And for expanding the intervention, of course, this would require money.
Thank you. Thanks. Yes, to the gentleman at the back, and then we come back to the front, please.
Hi, morning. My name is Chief Warner. I'm a member of the Defence Cultural Support Unit. I've got two questions. First is in relation to the patterns of drug use or drug trafficking. Do you see a difference in the different areas? So, for example, in the north or the south or the Pashtun areas or the Uzbek areas bordering Uzbekistan, do you see a different pattern of trafficking, or in essence, what I'm trying to ask is, do you think you will see a situation like in Mexico where one group would move into another group's territory, or do you think that those cultural groupings prevent that from happening? Second question is in terms of the significant loss of territory over this fighting season. Has that had any discernible effects that you've seen? So, for example, have the Taliban reinstated their previous bans on the narcotic growth or trafficking, or is it, are they still just leaving it as it is and taxing it? Thank you.
Thank you. Sir.
Thank you. Ministers, I'm just wondering, both of you mentioned about border control and neighbors, the role neighbors play, particularly Pakistan was mentioned. And I'm a special interest because I was once in the Pakistani military and served in the frontier area for about 2 years. Pakistan has, at least for 12 to 15 years, been requesting enforcement of border control along the Durand line, but this became such a political hot potato for Afghanistan. Kabul has never accepted that. But would sort of border control enforcement with the kind of fence that the Pakistanis have proposed, would that help control movement of pushers and traders and smugglers and mules and so on, or would it not? Thank you.
Thank you. Okay, John, just one more question.
John Collins, LSE Ideas. We've talked a bit about alternative development, and I think the sense I get is that you're saying it failed when there wasn't eradication used. My understanding of the academic literature on this is that alternative development is just widely used as quite a failed paradigm, and a lot of it is to do with not looking at the actual economic determinants of why people grow crops. So could you maybe elaborate a bit further on what you've learned from the failures of AB and what potential next steps would be?
Okay.
Okay. Thank you. Patterns of trafficking, no. I think it's most the same, except what they do is they use the airports. It's a bit different than they do it on from land to land or from land to water. The rest, I think it's because we have it will be different in Mexico because here we have an active insurgency with the Taliban. The new ISIS is there, but at least ISIS and Daesh and this area particularly are different. ISIS doesn't allow poppy, and Taliban are part of that. So that's why I think this is all controlled by that big group there. Even the routes inside the country doesn't show it. It's almost the same groups there. But the way they use it, they take it out of the country. Definitely airports, which used rarely, it's a bit different than they use it. We have a small. I don't have a map, I wish I had bring. There is a small corner we have, which is in the south of the country, and that touches Iran and Pakistan at the same. So it's a triangle there, and most of that happens there. I believe it's because it's easy to transport it either side of that. On the border control, I don't think that's helping because at least in the past couple of years, we have tried many times to sit with Pakistani officials or counterparts. We were unsuccessful to do that. So until we really sit and discuss what we want, it's only building a fence around the border is not going to help us. It has to be discussed first what we really need from them, and then can decide what to do. So that's why we believe what is happening now. That's why the government is shouting a lot. It's more politically than really solving the issues. So we have to discuss it first. What could solve our issues, and then can act based on them. Alternative livelihood, I agree. It's a very wide range. It's a term that could use for anything. It's alternative. But what we believe what would help, which the data that at least we have collected in the past years, is that if we couple the alternative livelihood with policing and legal implementation of the legal aspect of the law, if I can call it. Because it's obvious no other crop in the market can give that much benefit. So it's not mere economy. It's not economical terms merely just comparing this and that. There has to be the other factors in that. And that's what we said before. It has to be that package. There has to be the fear of the law. There has to be the alternative package. And then in a society like Afghanistan, you also should have the ground, the people in the community, the elders who influence, who can tell them not to do it. So if that all comes together, yes, it would help. But if it's only, that's why we're losing on that, because that has been at least my fight for the last 6-7 months, telling a lot of our donor friends that don't give money only for the time saying alternative livelihood. It's not going to take us anywhere. This has to be the package. And then it has its impact, and there is data for that, at least in the last 5 years, to clearly show that in the areas where that entire package was implemented, it was effective. If that entire package was not implemented, it's very difficult to go with one bits and pieces.
Can you tell us a little bit about different patterns of drug use across the country?
The drugs, as opposed to what is very commonly used globally, In Afghanistan, we have a different pattern, and globally, it's mainly the stimulants. Cannabis is the first one that is most commonly used, and then comes the stimulants like amphetamine, and then opioids. In Afghanistan, there's about over 2 million people that tested positive, for opium. Opioids, and then and the second rank was cannabis, and the stimulants are coming third. So that's the pattern people use.
Antoine, and then Antoine.
Thank you. I have two questions for Minister Naeem. First, is there a link between the drug problem and the economy of drugs and Taliban's involvement in this, on the one hand, and prospects for peacemaking in Afghanistan? The second question relates to the ongoing Western train, advise and assist missions by the United States and NATO. Is there a counter-narcotics aspect to either of those two missions?
Thank you. Anton.
Anton Sampaio over here at the ISS. I wonder if this massive increase in drug consumption in Afghanistan, if it has had an impact on the emergence of problems that maybe weren't as prominent in Afghanistan before, which is basically gangs, which globally have been, some of the main actors in negotiating internally in cities, especially the transactions of drugs. Are gangs more of a problem now in Afghanistan, along with this increase in internal consumption? And related to that, we hear a lot about counterinsurgency, but could counter organized crime techniques that are more focused on investigations, police investigations, intelligence, creating this institutional strengthening of police investigation capacities, if that is also being attempted?
Thank you. Diva and then.
Yeah, I've got a question to Dr. Naeem. Can you give us some more information on the small children who are using drugs? There are mothers who are working because they have to work, and they give drugs to their small children. They might be age of few months. Is there any awareness programs for them?
Yeah, thank you very much. And yes, there are awareness programs, for the general population, and at the same time, there are sessions, that I talked about specifically, for the addicts and their families. And the children that tested positive, I think that's mainly in a family, the father or mother or the adults, they use narcotic drugs, and the smoke that is there, they are passive, smokers of what the adults are doing. Unfortunately, they are, and some of the mothers, just to make them quiet, so that they shouldn't cry, they are doing that. And probably some of you might have seen, the clip, from a mother, puffing, smoke of heroin, into the mouth of, their children, which is a shocking thing, to do, to quieten them. We are working, with those families, and at the same time, we have a treatment center and communities as well, but it's not everywhere, because of limited resources.
Oh yeah. The Taliban involvement, I think that's a valid concern, and we believe that now they depend more on this money than before. I think this is now a major part of the supporting their operations, and it's not only the economical part of that; it's also the social support that they get from the areas where you go there and say, I'm going to help you with your fields, and you have to give me protection, or please give me space, and all that. Does it undermine the peace process? Yeah, I mean, when the benefits are at stake, does. But it's also that the peace process would help with narcotics, and also you can think of that way, that fighting narcotics is going to help with the peace process. So that goes together. The gangs, I don't think we have big famous gangs as there are in US or Mexico or anywhere else and all that, but definitely in these type of situations they tend to establish. The distribution in the streets where we have now these millions of youngsters being addicted, we believe there are small type of groups that operate. We do not have big gangs, especially I don't think it would be easy to make big gangs where already we have two big groups of active insurgents that they're doing. So it's easy for them to be part of the big groups than to create their own. But yes, it would help. It's not only that. I mean, it's a major part of that. We believe our narcotics problem as a big thing. It's related to Taliban insurgency, but on the streets of our own streets where the addiction is there, strengthening the police force and helping them, the police institutions, to deal more with the local gangs or the gangs that are not related to Taliban definitely would help. It is there. It's not that onto that minor level Taliban would be.
Okay. And I guess there was another point about the US and NATO and to what extent counter-narcotics feature into their current involvement in Afghanistan. But
what's the strategy? Finalized yet? I'm still waiting to see that strategy. How is that coming? With the current scenario that is on the ground there, it is the only major supporter that we have is US A now, that they are there and they're providing support. UK being involved with that police specifically, and that this one Cardiff project. I don't see many other donors. So yes, it's part of it. If you can look at it into that sense, yes, it is part of that. But since everyone is then, at least donors are involved in counterinsurgency, and everyone knows that insurgency is related to that, I would assume that this is also part of that. But I think in the recent months, this discussion that we had a couple of seminars in Kabul where many of our friends from DC came in, and also from other donors, the problem of narcotics is getting more prominence and everyone clearly understands it. So I would hope that in the coming strategies this would have a main, it would be a main agenda that the ones that are developing rapidly.
Thank you. I think we have time for three final questions. The gentleman over there, then Danny, and then Jens. Please.
Donor Ministers, thank you very much. Trevor Rod for Ministry of Defence, specifically for Deputy Kane. So you quoted to us earlier on UN figures at about 4,800 tonnes of opium production last year, which is about 480 tonnes of heroin. Using your own figures of precursor chemicals, and that's the question, that would about equate to just under 5 million tonnes of acetic anhydride, which would be required. Now, assuming 2/3 only is produced in heroin, for the sake of argument, that's still 3 million tonnes of acetic anhydride. Now, I accept that not all of it is produced inside the borders of Afghanistan. However, that is a colossal figure of liquid which needs to come across your borders in. Two questions. First question. Last year, how many litres were seized by the Afghan border police or government institutions within the borders of Afghanistan? And secondly, again, UN figures. If the price per litre of illegal acetic anhydride is static for the last 2 or 3 years at $200 per litre, does that not suggest that actually nothing has happened within government forces to try and make it harder to import AA into Afghanistan?
Thank you. Danny?
Yeah, we know that the progress here is difficult and complex, multifaceted, and above all slow. If we look 10, 20 years ahead, 2027, 2037, I'd be interested to know what both of you think could be achieved, what your aspirations are for the generation.
Yeah. Thank you. And the final question for Jens.
Yes, thank you. We've seen the Taliban strengthening in northern Afghanistan in the past few years, Kunduz, most obviously, Faryab, Badakhshan provinces. I was wondering if you're also seeing at the same time an increase in opium cultivation spreading more in the north of Afghanistan as well.
Okay. All right. Thank you. So this is
I'll
your
leave what
chance.
could be achieved to him first,
Yes.
what he could achieve in the treatments, and then I'll come to the narcotics, which
what
will
you-
be the difficult one to
what
tell
could
you.
be achieved in the next
in matter
generation.
of treatment and all that.
The Ministry of Public Health has been, working on treatment of drug addicts, at the same time working on prevention of addiction. We have treated a number of cases of addiction. If we compare ourselves, the 2011 and 2016, there is a capacity has been developed to treat more addicts, and by working in 32 provinces where we have treatment centers, and at the same time if we compare 2011, there were about 6,000 people treated, and now 2016 it's about 41,000, and the current capacity is over 30,000 addicts can be treated. Our efforts are, to be very frank, we do not have a major impact, on addiction, because until and unless we have some training, for them, which is now training is provided, on professional, vocational training by the Ministry of Labor and Social Affairs, and again, unemployment is a problem in Afghanistan. If they are not finding a job, I mean, they do not earn, something for them, they go into depression, and finally they revert back, to narcotic drugs. So probably when I mentioned that we need to improve coordination, is about the different ministries. If we do not work hand in hand, probably we do not have a major impact on them. We are hopeful that we mainstream the counter-narcotics or addiction treatment and prevention into the basic package of health services, which is for the whole country. Currently, we are providing the health services, and the prevention of addiction should become part of that package. Because the resources are limited, and vertical programs usually, they first of all, they are very expensive, and the second thing is, we cannot sustain them, and in order to sustain them, we need to mainstream them.
Thank you. Thank you very much. I'll go with the acetaldehyde first, and I'm going to correct my figures. I think I said that 7 to 10 kilos of acetaldehyde, but that's 7 to 10 kgs of poppy for heroin. But acetaldehyde is 1.2, but it still remains the same thing. It's a bulk. Not that much, but it's still a bulk. I don't have the figures, but every year we have that in tons. We confiscate in tons of acetaldehyde. But the real problem is that we've recently seen, when I was giving you the figures of the prices as well, that they don't transport it much inside the country anymore. It's been easier for them to do it in the borders, where they do also the cultivation, and in the areas where acetaldehyde is not illegal. It's in many countries it's not illegal. So it's easy to do it from the other side. And then in the market, it has been also seen in recent years that the prices for the Afghan heroin is not as high as in the other countries' heroin. I don't know why. It's stated that probably because of the purity of that. So probably that shift is somehow changing the way it was produced, at least in the areas it was produced. That's why I think we also see that decrease in the amount of the confiscation of acetaldehyde, because it doesn't go through the city anymore a lot, at least inside the country. It's very much in the borders. With that said, stability, that's why I was saying that we still have to work with our police and strengthen that institutions to do more. That's also a reality. Poppy in the south and it's also in the north, yes, it's because some parts of the north has also been relatively insecure compared to other years, and then especially in the areas where at least they have a chance to do some of the trafficking. We're seeing that happening. What could be achieved, I don't know, but one thing is clear, the option of doing nothing is disastrous. We have to look into it. We can shift our policies, we can look into the data in past decade, we can work on it, we can come up with different programs. One thing we believe, at least from our side, the government of Afghanistan is firmly committed. We are there, and we are there to work with our international partners. We may not have enough resources, but whatever the resources we have, with those resources we're committed to do. Definitely it affects our fight. So if we do not have resources, it may not be a very efficient or effective fight. But at least the data suggests that if we do all these efforts together, nationally where we talked about alternative livelihood eradication, police and all that, then the regional factors, which are very important. If all that works together, I think it will have huge success. Not even looking into the international demand on that. But if that doesn't work, all that doesn't work together, the success is not very clear. So we're hopeful that at least with the trend that has started, and from that you can even see that today's meeting is there, that we're talking about that. So I'm at least happy that we're talking about this issue seriously from such prestigious institutes. I believe that would raise awareness more in the countries in the region, and we all work together. So in that sense, we may achieve more. But I'm hopeful for that.
Thank you very much. This has been a very stimulating session. I would like to thank Dr. Naeem and Dr. Kaim for sharing their views so generously, and also to all of you for your comments and participation. Just to remind you, lunch is served just across the hall. And please come back here at 12:30. We have another event looking at US policy in South Asia under the Trump administration. All is left for me to say is thank you again, and
Thank you
see
very
you
much.
soon.
Thank you so much.